Hello, my name is Quach from St Vincent's Hospital in Melbourne and the University of Melbourne, Australia. The abstract that I am discussing here is an interim finding of a phase 1b study that assesses the outcome of administering an anti-CD38 monoclonal antibody called Isatuximab through the skin via an on-body delivery system in combination with pomalidomide and dexamethasone for the treatment of relapsed refractory multiple myeloma. So Isatuximab is a monoclonal antibody that works by binding to a protein which is highly expressed on the surface of myeloma cells called CD38, and it can induce myeloma cell death through multiple mechanisms of actions, including immune-mediated cell death. And currently, Isatuximab is approved in combination with pomalidomide and dexamethasone for the treatment of patients with relapsed or refractory multiple myeloma who've had at least 2 prior lines of treatment, and that's based on the outcome of the phase 3 Icaria study. But Isatuximab is given currently as an intravenous formulation that can take over an hour, up to an hour and a half to deliver. So therefore, injections of Isatuximab through the skin is going to be more convenient for our patients, and it will take up less hospital resources, and that's the rationale for this study. So this phase 1b study evaluated the safety and efficacy as well as pharmacokinetics. So that's the way that the body handles the drug, and comparing between subcutaneous versus intravenous Isatuximab in combination with pomalidomide and dexamethasone. And previously, we've already reported the results of the first cohort of patients in this study, and that showed that subcutaneous Isatuximab administration via a syringe pump had similar effectiveness and safety compared to the intravenous Isatuximab formulation. And in that cohort, we reported that the recommended phase 2 dose of Isatuximab to be given subcutaneously in combination with pomalidomide and dexamethasone was 1,400 milligrams. So in this report, where we are reporting the results of an expansion cohort of patients treated with subcutaneous Isatuximab at the recommended phase 2 dose, which is 1,400 milligrams, but this time administered via an on-body delivery system, which we'll call OBDS for short. And so this is a wearable injector that's applied to the abdomen, and the drug is automatically delivered through this device, and the patient doesn't even see the needle. So overall, 56 patients were randomized into the study and treated. There were 12 patients within the Isatuximab intravenous cohort, 12 patients in the Isatuximab subcutaneous cohort of 1,000 milligrams. There were 10 patients in the subcutaneous cohort of 1,400 milligrams, and these were delivered through the syringe pump. And there were 22 patients with Isatuximab delivered through the device, the OBDS device that we're exploring at the recommended phase 2 dose of 1,400 milligrams. And this is all in combination with pomalidomide and dexamethasone. And so Isatuximab, both IV and subcutaneous, were given at the usual schedule of once weekly for 4 weeks, and then every 2 weeks, and delivered ongoing until disease progression. So in terms of safety finding, the incidence and severity of the adverse events were very similar across all cohorts of patients, as were the profile of the adverse events. And importantly, infusion or injection reactions to Isatuximab were quite uncommon, and it occurred in less than 10% of patients in each of the cohort, and all were very mild and only occurred during the first administration. What's also important is that amongst the patient who had Isatuximab delivered through this device, the OBDS device, there were no infusion reactions at all. And the local tolerability of the OBDS device was very good. In fact, only 5 out of the 22 patients had experienced a local injection site reaction, but only 7 episodes out of a total of 305 administrations. So that's quite low. And in fact, all were very mild and all were grade 1. And duration of drug delivery through this device was 10 minutes at first and subsequent administration. And in terms of pharmacokinetics, so that's the way that the body handles the drug, this was very similar between the OBDS cohort and the patients receiving subcutaneous isatuximab through a syringe pump. And in terms of effectiveness, of the cohort of patients who received the recommended phase 2 dose of 1,400 milligram, that's both the subcutaneous 1,400 milligram cohort and the OBDS cohort, the overall response rate was 78%. So this is very comparable to the type of response rate that we see with intravenous isatuximab in the phase 3 ICARIA study. In terms of progression-free survival, the estimated progression-free survival was 22 months in the IV cohorts. It was 12.5 months in the subcutaneous 1,000 milligram cohort, but not reached in the subcutaneous 1,400 milligram cohort or the OBDS cohort of patients. So what we can conclude from this data is that isatuximab, when administered through the skin, i.e. subcutaneously, and through this device, the on-body delivery system, at the recommended phase 2 dose of 1,400 milligram is safe. It has a safety profile very consistent with what we see with intravenous isatuximab, but importantly with no infusion or injection reactions, and excellent local tolerability. And the effectiveness that we saw was comparable to that observed in the phase 3 ICARIA study with intravenous isatuximab. So in summary, isatuximab administration subcutaneously via this device is well tolerated. It requires a short duration of injection and provides a very convenient hands-free options for our patients. And I think this abstract is important to the myeloma community, particularly in patients, because the results will pave way for the availability of subcutaneous isatuximab delivered through this device, the OBDS device. It's safe and it's convenient for our patients, particularly because when we use isatuximab, we tend to use it until disease progression. So there's only so much a person can tolerate having their veins punctured, and most people run out of veins with time. And this will no doubt improve the quality of life for our patients, and no doubt reduce the resource burden for our hospitals compared to the intravenous method, which takes around 70 minutes or longer, and time in the chemotherapy chair and nursing resource as well. So that's all I have to say, and I'll stop there, and I want to thank you for your attention.